Assalamu alaikum. My name is Dr. Yasser. Today I'm uploading a video which I made a couple of weeks ago. This is introductory video for the central access for hemodialysis, and this is mainly intended for the junior doctors who can come across hemodialysis patient in their A&E or in acute wards. The purpose is just to get familiarized with the types of the central access. I hope you will learn from this video. Let's watch the video. There are mainly three types of catheters. This is the one which we call as VAS cap. This is the temporary line. It can either be used in the internal jugular vein or in the femoral vein. And the maximum duration for this line to stay in is only 5 days. After 5 days, due to risk of infection, this line should come out. So if we look at this line a bit more closer, then I will show you that there are different sizes of that. One is the 15 centimeter and one is the 20 centimeter. Usually for the neck we use the 15 centimeter. So there are two separate lumens, and one is the arterial and one is for the venous. So after 5 days we need to remove the line. Now there are two other central line for the dialysis patient. This one and this one. They both are called as tunneled lines. So what is the difference between these two lines? I'll explain you that in a second. So these two lines, this one is called perm cath and this line is called Tassio line. So perm cath, usually as a nephrology physician, we used to insert line in the right internal jugular vein. If we look at this line a little bit closer, this is a one big diameter, and inside this, if you can see a little bit from here, there are two separate lumens. One is for the vein, one is for the artery, and there is a one cuff which is adjacent to this bunk. So the line is inserted into the vein and does get tunneled on the upper right chest, and this cuff does get embedded inside the skin so that it does not move out. And now in terms of this line, line can be used for 3 to 4 months, and meanwhile we can sort out the long-term access for the dialysis, with the preferred one is the fistula. Now the other type of tunneled line is called Tassio line. If I show you from here, this line has got two separate, these are entirely two separate lumens, and they are two entirely separate lines. So one is the blue one is the venous line and the red one is the arterial line. So it has got two cuffs. One is for this line and second one for this line. Again, the process of insertion is slightly different as compared to the perm cath. Normally this line is inserted by the interventional radiology, and again this line is also considered as intermediate access for the dialysis, and this line can last up to 3 to 5 months depending on the patient. Meanwhile, the permanent access or permanent method of renal replacement therapy can be arranged and planned. I hope you have enjoyed the video and might have learned something from it. I'm happy to receive any questions or comments. Thank you and Allah Hafiz.